Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our daily videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download some ebooks also free. The information of this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Hyperthermia in Direct Clinical Hypnosis, Scripts and Exercises. Exercises used in hyperthermia. In previous chapters, we have seen the importance in direct clinical hypnosis of the good combination between primary, secondary, and tertiary exercises. Secondary and tertiary exercises. In hyperthermia, this combination is also of vital importance. In this section, the primary exercises would be the different visualizations that induce the elevation of heat plus the visualization of cleansing and healing of the treated area. The secondary exercises would be those in charge of raising the patient's defenses, as well as the positiving and happiness increasing exercises. The tertiary exercises would be those that the patient has to do at home, where the patient, after self-relaxation, visualizes how the tumor shrinks, burns, dries up, gradually until it disappears completely. It is of vital importance within the tertiary exercises that the patient is fully convinced that he or she can change the course of his or her illness. Primary exercises: flamethrower, burning rods, fire, abrasive acid, volcano, cream. Secondary exercises: warp technique, stimulating defenses, Coe method, the beacon of hope, the 7 energy points, all positive, a drop of happiness, etc. Tertiary exercises practiced by the patient. Relaxation combined with visualizations, where he visualizes the disappearance of the tumor and the consequent cure of the disease. We also try to change the patient's catastrophic beliefs about their illness. The combination of relaxation plus visualization is an excellent technique to create and reinforce the patient's beliefs about their ability to recover from cancer. It would also be very interesting to address the possible onset of anxiety or depression due to a medical illness. In this case, due to the news of being sick with cancer. All this combination makes for greater therapeutic efficacy. It is also important to highlight the therapeutic success of combining medical therapies with hypnotic hyperthermia. We will always induce the patient to follow their medical treatment, radiotherapy, chemotherapy. We advise to practice only hypothermia without medical combination, only if the patient has been given up by medicine. Hence, the importance of combining both therapies, medical and hypnotic hypothermia. For the recovery from the disease, medicine only uses one way: the reduction of abnormal cells by means of radiation, chemotherapy, surgery, etc. From direct clinical hypnosis, we approach the recovery from 3 ways: the reduction of abnormal cells through the application of hyperthermia, using primary exercises without refusing the possibility of combining it with medical therapy, an increase of the immune activity by means of the secondary exercises, involving the patient in the fight against his illness, also by making him change his beliefs about the illness and trying to make the situation positive in order to avoid falling into the spiral of hopelessness as far as possible. All this through tertiary exercises. Scripts. Visualization 1. Flamethrower. The patient has to visualize how little men burn the affected organ with flamethrowers. Visualization 2. Burning rod. The patient has to visualize how a red-hot iron bar penetrates the affected organ. The patient has to visualize how a red-hot iron bar penetrates the affected organ and passes through it, dragging and burning all that is evil. Visualization 3. Fire. The patient has to visualize a fire with internal flames inside the affected organ. Visualization 4. Abrasive acid. The patient has to visualize how an abrasive acid penetrates into the tumor and burns it. Visualization 5. Volcano. For large areas, visualize how the hot lava of the volcano moves progressively over the whole affected area. At the same time, we also pass our hand over it. This is used when the area to be treated is larger than our hands can cover. Otherwise, we will have to do it in sub-areas until the whole area of the area to be treated is covered. Visualization 6. Clean. The patient must visualize the affected organ clean of bad cells. He must visualize it totally clean. Practical example of the scripts used in hyperthermia. I want you to visualize how through the pores of the skin of my hands, tiny little men come out. There are millions of them, and they are all equipped with flamethrowers. They penetrate inside you through the pores of your skin. Now these little men with flamethrowers go to affected organ, area to be treated, etc., and start burning it. Visualize how they shoot jets of flames with the flamethrowers. Visualize it. There are millions of little men with millions of flamethrowers. They are burning the evil. They melt it. They melt it. They melt it. They burn it until the evil is totally gone. There is so much fire in there. There is so much fire that there is a big fire. Visualize the flames and they burn all the evil. Visualize the flames as they burn and devour the evil cells. Now imagine how a red-hot iron is going through the area, burning and sweeping away everything bad, leaving nothing, leaving no trace of evil. Now I will count from 3 to 0, and when I say 0, a scorching acid will enter. It will burn everything bad, everything. 3, 2, 1, 0. Now, feel how the burning acid burns everything bad. Feel it. It burns everything bad, everything, leaving nothing, cleansing everything. Now I want you to visualize that whole area clean, healed, healthy, without you knowing it, without you noticing it. The heat will continue to work throughout the week, burning what little is left. This is followed by the appropriate secondary exercises to stimulate the patient's immune system. Once out of the trance state, we give instructions for the tertiary exercises to be performed by the patient at home. If you're interested in learning more about clinical hypnosis, watch our next video, Hyperthermia in Direct Clinical Hypnosis, Wish and Desire to Keep on Living, Part 1. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download some free ebooks. If you have any questions, add them in the comment area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.